Hi, Kevin Henry, Managing Editor of Dental Economics, here today with Dr. Michael Schuster from the Schuster Center in Scottsdale, Arizona. And I think most of you have heard of the 80-20 principle. But what we're going to do is talk today about 3 areas where the 80-20 principle can really apply in your own practice and in your life. So where are the 3 areas that you think dentists need to be more cognizant of the 80-20 principle?
Well, I think it could be tremendously beneficial with money. In other words, if I think of, you know, the 80-20, when I first started working and thinking about percentage budgeting, 50% goes to run your business, you live on 30%, and 20% of the revenues you make are your profit. Okay? So obviously your personal income is taxed and your profit is taxed, but 50, 30, 20. In other words, we're going to spend 80, preserve 20. So percentage budgeting really helps you really think about, you know, how am I going to organize that? The second part where I think 80-20 comes in big is with the issue of time management. You don't have the time to do everything, but you do have the time to do what's most important. So if you're going to 80-20 and really increase your productivity substantially, you're going to be really thinking about what's the highest and best use of my time. How do I leverage myself? How do I leverage my time? And there's things then that you're not going to have time for that you're going to kind of move out of your life. So I think we can do percentage, what I like to refer to as percentage budgeting with money, percentage budgeting with time. And of course that percentage budgeting with time leads over to color coding, block scheduling. The third area that I think 80-20 really works well with is goals. And when I was playing a lot of golf, I had a golf shrink or a golf psychologist by the name of Chuck Hogan. And Chuck's worked with a lot of the pros. And one of the things he used to say over and over again is you can have anything you want, you just can't have everything you want. So then he goes, so what do you want? What do you want? Well, I can't have everything I want. You know, life doesn't work that way. But can I have the things that I want most, the things that mean the most to me? So when I go about setting goals for myself, I think about, you know, what are my top things that I really love to do? And for me, it's flying and motorcycling and hiking. What kinds of dentistry am I really good at and I really love to do? Well, for me, it's restorative dentistry and prosthetic dentistry. And if I think about what am I really good at doing for the center, it's lecturing, it's writing, it's interviewing and working with the so there's certain things I'm really good at. I can't do everything, so I just focus on those. So I think it's time, I think it's money, and I think it's goal setting. Those 3 areas. 80-20 is at play at all times, whether we realize it or not. In other words, if I'm getting too busy, it's probably because I'm doing the wrong things. If I don't have enough money, it's probably because you know, I'm spending money. I'm not what is most important. And if I'm not moving ahead with my life or my practice, it's probably because I'm not sitting down and setting goals for those areas that are most important.
Very great thoughts. Thanks for the time.
Thank you.